Hello everyone. Today's topic is most common pregnancy complications, that too trimester wise. Okay, every pregnancy is different, every woman is different. In the same way, every trimester is different. For some of the women, pregnancy will be very smooth, and for some of the women, it will be very problematic and very complicated. So in this video, we will discuss what are the most common pregnancy complications which a woman can face. Okay, let's go then. First trimester. In first trimester, most of the women will have nausea and vomiting as a early pregnancy symptom. Thankfully, I didn't had it. Okay, and most of the people feel that it is a normal early pregnancy symptom and it is common too. And some of the women feel that it is mandatory and we should have it if we are pregnant. Okay, but that is not the case, and it is not compulsory to have nausea and vomiting, and that too up to certain level. If you have nausea and vomiting, that is okay, but when it causes dehydration and weight loss to a pregnant woman, then we have to take care of it and have to inform gynae. Okay, and dehydration and weight loss are not at all a good sign, and this condition, severe nausea and vomiting which causes weight loss and dehydration, is called as hyperemesis gravidarum. Okay, and if you have this severe condition, you have to talk to your gynae. Okay, and this is the very first pregnancy complication which can be seen in most of the women. Next one is infection, that too urinary tract infection. Urinary tract infection is the UTI, that is UTI, and which is more common during pregnancy. Though you are not so sure about pregnancy, whether you have conceived or not, if you go to doctor after your marriage just to report about your UTI, as you have got so much of itching or you are facing so much of pain, if you go and tell this to your doctor, and if they notice that this is the symptom of UTI, definitely they will give you the pregnancy test. Okay, so this is the most common complication in pregnancy. If it is not treated, if you are not taking medicine, then it can spread to your kidneys also. Okay, so UTI is the another complication which usually most of the women will face. Along with that, STI is the another one, that is sexually transmitted infection. This can happen in any of the trimester, obviously, when you have intercourse. Okay, even this should be treated as soon as possible. Next is ectopic pregnancy and chemical pregnancy. In ectopic pregnancy, baby grows out of the uterus, and in chemical pregnancy, before confirmation, before clinical confirmation, you baby will stop growing. Okay, you will know it that you are pregnant, but before clinical assurance, baby will stop growing. Okay, that is chemical pregnancy. So I'm just trying to put it in a simple way so everyone can understand. Okay, other than this, threatened abortion means you will see bleeding or spotting during your first trimester. That is called threatened pregnancy or threatened abortion. In this case, pregnancy may continue or may stop. There is no guarantee, but if you are seeing bleeding or spotting during your first trimester or throughout the pregnancy anywhere, if you are seeing any spotting and bleeding, means you have to talk to your gynae, as it is not a good sign. Next one is subchronic hematoma. Subchronic hematoma is a case where bleeding will be there inside your uterus, and sometimes it may harm your baby and sometimes it may not harm your baby, because of which because of subchronic hematoma you will face bleeding also and spotting also. Sometimes you will face severe bleeding also, which is equal to abortion. Okay, so whenever you see or if you observe spotting or bleeding, immediately you have to visit doctor. And sometimes this bleeding which happens in first trimester or in the third trimester or in the second trimester, wherever it is, Most of the time, if it is in the first trimester, obviously it will be showing or it may indicate upcoming miscarriage. Okay, so you should be very careful. As soon as you see or you observe spotting or bleeding, you have to visit your gynae. And this is the another major issue, that is subchronic hematoma. I have faced in both the pregnancies, and first one I faced subchronic hematoma and I lost the baby, and the second trimester, God's grace, first trimester only, in second pregnancy, first trimester I faced subchronic hematoma. I thought this is also gone, but okay, I blessed with baby girl. Now the complications during second trimester. Okay, in this, the first one is a preeclampsia. Preeclampsia is nothing but a high BP after 20 weeks. Still yesterday you will be all right, and today all of a sudden from nowhere your BP goes high and spikes. That is preeclampsia. Okay, so much of BP, and even the low BP also is not so good in your pregnancy, and preeclampsia indicates some discomfort or some problem with the baby. It will cause some problem with the baby, and in some of the cases it will be life threatening for baby and mother both. Okay, and throughout my pregnancy my BP was so low, and my gynae used to scold me like anything. Okay, and usually people say that if any person is getting angry for all small things, small matters, means it means that their BP is so high. I'm that kind of person who who gets angry for small things also, even though I had very low BP, which was very crucial. The next major complication during second trimester is GDM. GDM is nothing but gestational diabetes mellitus. It is nothing but a pregnant woman developing diabetes. Okay, so means before pregnancy there was no diabetes and sugar levels were very normal, and all of a sudden in second trimester, if your sugar levels are so high, more than the normal ranges, it means that you have developed sugar or diabetes during pregnancy. Okay, that is called gestational diabetes mellitus, and usually it goes off after delivery. Okay, no need to worry about that, but during pregnancy it is so complicated. If you have GDM, your food habits, your sugar levels, your baby growth, baby will grow so large, it seems. Okay, if you have 20 weeks baby in your tummy, and if you get a GDM, baby will grow more, means it will reach the growth of 24 weeks baby. Okay, so that is the difference. And once if your baby grows so much, and there will not be a normal delivery. Okay, if you have GDM, doctors will never try for normal delivery. That is one thing. And if you have GDM, it is so life threatening for baby one, and amniotic fluid will fluctuate like anything. Okay, you have to control amniotic fluids also. Amniotic fluid is nothing but the fluid which surrounds the baby in your tummy. Okay, and this is the major issue in pregnancy which can happen in second trimester. Next major complication is a placenta previa, which can happen in second trimester and can be continued through to third trimester also. In placenta previa, what happens? Placenta covers the cervix. Cervix is the entrance of the uterus or the exit of the uterus through which the baby comes out. Okay, if the placenta covers this cervix, baby can't go out. Okay, so it can create so many problems, including bleeding and spotting before delivery, and can cause preterm delivery also. Okay, and if you have placenta previa, you can't have a normal delivery also. So placenta previa is the major issue that can happen or that can develop in second trimester and can be continued or can be solved by itself as pregnancy continues, because placenta grows. As baby grows, placenta will also grow, and it can move or it may move in any other direction, which is called as a placental drift. Okay, if there is a drift, if there is a placental drift, obviously placenta previa will be solved and placenta moves away from the cervix, so giving the place for normal delivery. Okay, if that happens, that is good enough. If that is not happening, doctors will suggest you what can be done. Next major complication is placental abruption. Placental abruption is, okay, if this is the uterine wall, this is the placenta, it will be like this. Okay, before delivery, if the placenta comes out or moves out like this or detach from the endometrium or uterine wall, okay, this is the uterine wall, this is the placenta, it should be holding like this throughout the pregnancy. If it detaches, it is called as a placental abruption. This may happen because of several reasons, and once this happens, baby will not survive, as placenta is the bridge between baby and mommy, through which all nutrients and oxygen will be supplied to baby. Once this bridge detaches, there will be no connectivity between baby and mom, and baby can't survive. Okay, and this can happen in second trimester or the third trimester. For me, it happened in second trimester. Okay, because of which I lost my baby in first pregnancy. Okay, and I had GDM, I had subchronic hematoma, and my BP was low, and I had placental abruption, and I had subchronic hematoma also, and bleeding also. And another major complication during second trimester is cervical insufficiency. Okay, as I said before, cervix is the entrance or the exit, or you can consider it as a door for the uterus. Okay, and it should hold baby inside, means if the baby should be inside the uterus, means this cervix, which acts as a door for the uterus, should remain closed throughout the pregnancy. It should not open. If once the door is open, baby will comes out. Okay, so this is simple logic. So throughout pregnancy, cervix should be closed like this. Okay, when this cervix is not so strong to hold the pregnancy inside the uterus, or if it is so weak and if it is opening like this, then baby can come out. Okay, so when this cervix is not so strong, when it is weak, when it can't hold the pregnancy, or when it can't hold baby inside the uterus, then it is called as a cervical insufficiency or incompetent cervix or weak cervix. Okay, this can happen in second trimester also or in the third trimester also. Most of the time it can be noticed in second trimester, as so many scans will be there, anatomy scans will be there, or some other scans will be there in second trimester. Okay, and once if the doctor notice the cervical condition, doctors will decide whether it is strong or not. Depending on that, doctors can give a stitch to cervix. Okay, you can consider it as a latch to this door. Means if cervix is the door, stitches will act as a latch. Okay, so that it can hold pregnancy as long as possible. Okay, so always doctors will try to carry forward at least 2 weeks, two weeks more, like this they will try to hold pregnancy. Okay, then if cervical stitches are given, what should be done, what are the medicines, everything they will tell. If you follow the whatever instructions given by the doctor, then no need to worry. The last trimester, that is third trimester, most of the women will develop preeclampsia in second trimester, and some of the women will develop preeclampsia in the third trimester also. Preeclampsia is nothing but a high bp, sudden high bp. Since till yesterday you will be all right and your blood pressure will be so normal, and today all of a sudden there will be a spike in blood pressure levels. Okay, if that is the case, you have to visit your doctor. Okay, this is a major complication in third trimester. Sudden bleeding or spotting. This bleeding or spotting can happen in first trimester also, which indicate miscarriage and subchronic hematoma or placenta previa or cervical insufficiency also. In any of the trimester, this bleeding or spotting may indicate any of whatever I said, those reasons. Okay, and in the third trimester, if you are experiencing bleeding or spotting, means you may have preterm delivery. Okay, next major complication is oligohydramnios or polyhydramnios. It means too high or too low amniotic fluid. Amniotic fluid is nothing but the fluid or the water content which surrounds a baby inside your uterus. Okay, so for every week there is a particular quantity of amniotic fluid should be there around the baby. If it is so high, then also it is a problem. If it is so low, then also it's a problem. And when it is so low, baby can't survive, because for a fetal movement, for baby movement, amniotic fluid is so important. And because of this low amniotic fluid, sister my own sister lost her baby in 7th month. Okay, she didn't even know about it. She was not at all aware of it, and she lost it. And the whole day there was no movement. And the next day when she went to doctor to ask about it, by then it was done. Okay, so you should be very careful about the baby movements also. In the last trimester, you have to count kicks also. Okay, and amniotic fluid levels also, if it is so high also it is a problem. If it is so low, then also it is a complication. It can be considered as a pregnancy complication. Next one is anemia. Anemia means obviously low HP, iron will be low. As you visit a doctor, once your home pregnancy test, if as soon as pregnancy is confirmed through scans and blood reports, doctor will start calcium and iron supplements more for most of the women. Okay, though even after that, if you are not taking iron supplements, because iron supplements will cause vomiting sensation and so many other issues, very discussing it is. And if you are not taking iron supplement and your HB is so low, and or maybe because of a bleeding issue or any other issue, if your HB is so low, even in the third trimester, means there will be a reduced oxygen supply and nutrient supply to your baby. If this is the case, then comes the picture of intrauterine growth retardation, means your baby is not growing according to standards. Okay, once if this happens, what doctors say, baby is not growing, you have to. Okay, so if even though you are not okay, even though you won't like, you have to take iron supplements and you have to take iron rich foods throughout your pregnancy. And though it looks so negligible complication or a problem during pregnancy, it affects more. Okay, and it can create a big problem to your baby. Next complication is a breech position baby or umbilical cord around baby's neck, 2 turns or 3 turns, or failure to grow. For no reason, for all of a sudden baby will stop growing and there will be no reason for it. Okay, so these are the most common complications one can face throughout pregnancy in third trimester. These are the most common complications, major complications one can face throughout their pregnancy. And if you have any other doubt, please comment, and I will try to answer it. And if you feel this video informative, please like, share and subscribe my channel. Thank you.